Local healthcare officials today are working to remind people the pandemic is not over.
In tonight's KX Conversation, we're joined by Bismarck-Burley Public Health Director Renae Moch. Renae, thanks for being here.
And Renae, infections of COVID-19 have risen in the past 6 weeks from 14 active cases to 328 active cases in Burley-Morton. We're at the highest active case number in the area since December of 2020. What's different than where we were at last year?
So there are several things that are different this time around. First off, we have a tool that we didn't have last fall, and that is the COVID-19 vaccination. And it's available to people that are ages 12 and older, and Pfizer has been recently approved as an FDA-approved vaccine for ages 16 and older. And so we're really encouraging people to take advantage of that because that is the best way to prevent severe illness and hospitalizations and even deaths at this point. The other piece that we're really concerned about is the Delta variant. It's a different variant than we have dealt with in the past. This one is twice as contagious. It spreads easily. So if you're thinking last year, 2 to 3 people would be infected with one positive case, and this year it's 6 to 7 individuals is what they're estimating. And so it could be a much more difficult type of outbreak to control when you have that much spread between individuals, especially as we are looking at our children going back to school and going back to college and resuming all sorts of activities.
Now, you joined with other healthcare officials in a public letter today. In the letter, you mentioned everyone doing their part to keep infections down. What does that mean to you?
So we really thought it would be best. We're all working on the same types of things in healthcare when it comes to COVID. We're doing COVID testing, we're doing immunizations, and then of course the hospitals are involved with treatment and care. And we all have been seeing the impacts on our resources. They're being stretched right now, and trying to get ahead of that as best as we can to avoid a real surge similar to what we had happen last fall. And we're encouraging the public to come together right now, mask up when you're indoors, get your vaccine, and we really need everybody to play their part. If you're sick, stay home. All those simple mitigation measures that we've been stressing all throughout the pandemic are still important, and we are still encouraging everyone to follow those protocols. So that is our message to the public, is we need your help in order to prevent a huge surge here in the Burley and Morton areas.
Renae, you mentioned the FDA approval of the Pfizer vaccine, and I was at a news conference just yesterday with the state health officer and some other health officials, and they expressed some hope that maybe that full approval will sway some people who have not received the vaccine yet. What are your thoughts? What do you think that the impact of that FDA approval will have?
I do think it will be an encouraging factor for those that have maybe been holding out, that felt that the vaccine was under that emergency use authorization and didn't have that final approval. So I'm hoping that it provides confidence in those individuals that have been holding out, that now is the time to get vaccinated. The vaccine is out there, it's readily available, and people can take advantage of that. So we're hoping to see an increase. We have seen increase in requests for appointments in the last few weeks here in our office, so that's really encouraging to see, and we're anticipating to see that as we go in the next few weeks as well, now that this approval has been announced.
And we're talking about healthcare, and of course, being a healthcare provider herself, whether someone gets a vaccine or whatever the situation is, they're still going to have to go to somewhere if they get sick. On that note, Renae, how's your patients holding up?
So I didn't hear the last part of that question. Could you repeat that?
How's your patients holding up as we continue to deal with this whole pandemic, as far as having to treat people, regardless whether they believe in a vaccine or a virus or anything like that? How are you holding up?
So we have been going at this now for 18 long months. Our staff, we're weary here when we think about what we've been through in the different stages of the pandemic. It's unfortunate that we are back in the same situation heading into the fall in 2021 that we were dealing with last year. And this is why we really wanted to, all of our healthcare facilities wanted to put out a plea for help, that we all need to pull together and do what we can. We've seen it before. We've known what's happened before, and it is our job now to really come together and do the right thing as far as preventing the repeat of last fall. So hopefully, for all of us working in healthcare, we can count on the public to commit to that.
And Renae, what concerns you most about our current situation?
What concerns me most right now is they're starting to see cases that are showing up in younger populations. We're seeing more children impacted this time around. People in their 20s and 30s are being hospitalized. We've had children that have been hospitalized, and that is very different from what we have seen with previous variants. And unfortunately, right now, the vaccine is not available for those that are under the age of 12. And so we have those kids in elementary school and beginning middle school that don't have an opportunity to get vaccinated. And we really have to think about them and what we can do to protect them as they start a new school year. So just something that is very concerning for me is just those kids that are headed back to school and knowing that this variant is so much more contagious, and we really need to pay attention to what we can do to prevent a serious implications.
Renae Moch, thank you very much.
Thank you.
Next up on KX News, from the burning